Good morning to my respected teachers and my dear friends. My name is Yamuna Chetri of BSc first year of San Fernando College. Today I will be giving my presentation on the topic hepatitis B virus. Now let's start with the introduction part. Hepatitis B virus belongs to the Hepatnaviridae class of the viruses. Hepatitis B is an infectious disease caused by the hepatitis B virus that affects the liver. It is a type of viral hepatitis. It can cause both acute and chronic infection. Now, acute infection causes liver inflammation, vomiting, jaundice, and death is rare. Chronic infection causes it may eventually cause cirrhosis and liver cancer. Many people have no symptoms during the initial infection. It was originally known as serum hepatitis. Infection is prevented by vaccination. More than 2 billion people have been infected with the hepatitis B, and this includes 350 million chronic carriers of the virus. Now, morphology of the hepatitis B virus. It is lipid envelope, icosahedral nucleocapsid, core composed of proteins. The nucleocapsid encloses the viral DNA polymerase that has reverse transcriptase activity. The outer envelope contains embedded proteins entry into susceptible cells. The virus is one of the smallest enveloped animal viruses. Hepatitis B virus is a complex 39 nanometer double-shelled particles. The outer surface or envelope contains hepatitis B surface antigen. It encloses an inner icosahedral 27 nanometer nucleocapsid. It contains hepatitis B core antigen. Inside the core is the genome of hepatitis B virus and a DNA-dependent DNA polymerase. The hepatitis B virus genome consists of a 3.2 kilobase pair molecules of circular double-stranded DNA of most unusual structure. The plus strand is incomplete, leaving 15 to 50 of the molecule single-stranded. From the core proteins is derived hepatitis B antigen. It is associated with the virion and is also found free in the plasma, especially when there is active replication. Along with the mature virions, two subvirions morphological forms are formed in large excess. Figure number 1. Spherical particles with the diameter of 22 nanometer, and figure 2. Elongated tubules of similar diameter. Both these pleomorphic structures are composed of HBsAg, which means hepatitis B surface antigen, are devoid of HBcAg, which means hepatitis B core antigen, and nucleic acid. They are not infectious and consist solely of surplus virion envelope. They normally occur in large 100 to 1000 fold excess over the mature 39 nanometer virions. Pathogenesis of the HBV, hepatitis B virus. The incubation period is very long, from 2 to 6 months after artificial inoculation of infected blood and blood products. Transmission is done by parental way, sexual way, microtraumas, and transplacental way. Microtraumas means small injuries in the body. Hepatitis B virus primarily interferes with the functions of the liver by replicating in liver cells known as hepatocytes. Virus enters through break in skin or mucous membrane or by injection into bloodstream. Reaches liver cells, multiplies and releases viruses into blood. Average 7 weeks of incubation. Hepatitis B carriers. About 5 to 10% of hepatitis B virus infection results in chronic carrier state. The latter may be defined as persistence of hepatitis B surface antigen in circulation for more than 6 months. And the carriers are of two types: super carriers and simple carriers. Super carriers they have HBe antigen, high titers of HBs antigen and DNA polymerase in their blood. Hepatitis B virus may also be demonstrable in their blood. Very minute amount of serum or blood from such carriers can transmit the infection. Simple carriers. These are more common types of carriers who have low level of hepatitis B surface antigen and no hepatitis B antigen. Hepatitis B virus and DNA polymerase in the blood, they transmit the infection only when large volumes of blood are transferred, as in blood transfusion. Laboratory diagnosis of hepatitis B virus. The diagnosis of HBV infection and its associated disease is based on a constellation of clinical, biochemical, histological and serologic findings. The laboratory can test for a wide range of HBV antigens and antibodies using immunoassays based on enzyme reactivity, EIA, and chemiluminescence, CLIA, and ELISA. HBV DNA can be quantified in serum or plasma using real-time polymerase chain reaction, PCR assays. Laboratory diagnosis of HBV infections can be carried out by detections of hepatitis B surface antigens, anti-HBs, HBe antigen, anti-HBe, immunoglobulin M, anti-HBc, immunoglobulin G, anti-HBc, and HBV DNA in the serum. Means hepatitis B virus DNA in the serum. This can be detected by sensitive and specific tests like, as I already said, ELISA and RIA. Prophylaxis of HBV. Measures for the control of HBV infections are the same as those for HIV infections, that is, screening of blood donors, use of sterile disposable syringes and needles by the health workers, and parenteral drug users, reduction of the number of sexual numbers, the use of condoms, etc. Health workers should wear gloves, gowns, masks, and eyeglasses to prevent exposure to blood and body fluids. Avoidance of mouth pipetting, eating or smoking in the place of work, and proper hand washing after work. Blood spills should be cleaned up with 2% glutaraldehyde or 0.5% sodium hypochlorite. Disposable equipment should be incinerated and Other equipment should be properly sterilized. Some mode of transmissions of hepatitis B virus are transmitted through blood and infected body fluids as well as through saliva, menstrual, vaginal, and seminal fluids. Transmit through direct blood to blood contact, unprotected sex, use of unsterile needles, and from an infected woman to her newborn during the delivery process. Infection can occur during medical, surgical, and dental procedures, tattooing, or through the use of razors and similar objects that are contaminated with infected blood. Rarely, hepatitis B can be transmitted through transfused blood products, donated livers, and other organs. However, it cannot be spread by holding hands, sharing eating utensils or drinking glasses, kissing, hugging, coughing, sneezing, or breastfeeding. Signs and symptoms of hepatitis B. Only 30% to 50% of adults develop significant symptoms during acute infection. The incubation period of the hepatitis virus is 75 days on average, but can vary from 30 to 180 days. Symptoms be like fever, fatigue, dark urine, loss of appetite, vomiting, nausea, joint pain, clay colored bowel movements, etc. Treatments are the condition often clears up on its own. Chronic cases requires medications and possibly a liver transplant. Medications, antiviral drug. Vaccines of hepatitis B. Hepatitis B is a vaccine preventable disease. A vaccine for hepatitis B has been available since 1982. The hepatitis B vaccine is safe and effective and is usually given as 3 to 4 shots over a 6-month period. Some of the vaccines are plasma derived vaccines, recombinant DNA derived vaccines,